Hello students. Students, in this recap, we'll be talking about how to approach a newborn with cyanosis. So, if a newborn present with cyanosis, we have to think of three main areas, that is the cardiovascular system involvement or respiratory system involvement or CNS involvement, and there are certain miscellaneous causes. In the cardiovascular involvement, we have congenital cyanotic heart disease. Okay. In the respiratory system, there can be lesions in the airways or the lungs. In the airways, there can be choanal atresia, perirobin sequence, intrinsic airway obstruction or extrinsic airway obstruction. In the lungs, we can have respiratory distress syndrome, transient tachypnea of newborn, meconium aspiration syndrome, pneumonia, congenital diaphragmatic hernia or pulmonary hypoplasias can be there. The central nervous system cause behind the cyanosis can be birth asphyxia, intracranial hemorrhage, intracranial hypertension, diaphragmatic palsy, neuromuscular disease or seizures. In the miscellaneous causes, we have to think of hypoglycemia, polycythemia or methemoglobinemia. So, how to differentiate between the different systems that can be responsible for the cyanosis in newborn? So, it depends upon the various signs and symptoms that we can see in newborn. So, if only tachypnea is present and no retractions is present, it occurs in the cases of CVS lesion. Tachypnea with retractions is in the cases of the respiratory pathology. No added breath sounds, CVS. Added breath sounds like wheeze, crackles, respiratory pathology. Added breath sounds can be heard in cardiovascular system also if it's associated with congestive heart failure. Heart murmurs present in CVS, not in respi. Chest radiography helps us in diagnosing the two conditions, and most important is the hyperoxia test, in which in the CVS lesions little or no increase in PO2 with oxygen administration, and in respiratory lesions oxygen administration improves or abolishes the cyanosis. In the CNS lesions, what we see is a shallow irregular breathing, poor muscular tone, and cyanosis disappears when the patient is stimulated or oxygen is given. This is how clinically we can differentiate the cause behind the cyanosis in a newborn. Also, if the SpO2 levels are less than 95% or there is a difference of more than 3% in the right hand and either foot, this is taken as to be positive, and echo has to be done in these patients to rule out any cardiac lesion. Hypoxia test I told you, chest X-ray I told you, and echo is the confirmatory test. The CHDs which are associated with cyanosis at birth are TGA, transposition of great arteries, total anomalous pulmonary venous communications, obstructive type, tricuspid atresia, pulmonary atresia and Epstein anomaly. Now, the cyanotic defects are divided into two categories, that are the defects associated with increased pulmonary blood flow and the defects associated with decreased pulmonary blood flow. In increased pulmonary blood flow, we have transposition of great arteries, total anomalous pulmonary venous return, truncus arteriosus and hypoplastic left heart syndrome. And in decreased pulmonary blood flow, we have tetralogy of Fallot, pulmonary atresia, tricuspid atresia and Epstein anomaly. Thank you.